Welcome back. Every week we learn more and more about COVID-19, and we want to keep you informed of the latest facts.
That's exactly right. This morning, Dr. Hawkinson with the University of Kansas Health System joining us live via Skype this morning. Doctor, we appreciate your time. One big question a lot of people are having, you see this on social media a lot, is ibuprofen safe to take if you're worried you might have symptoms? A lot of people are saying absolutely don't touch it. Is it okay to have ibuprofen?
Yeah, ibuprofen is of a class of drugs called NSAIDs, or non-steroidal anti-inflammatories. You know, we know that this type of drug can cause other problems and other serious illness, such as kidney injury, or even if it's not serious illness and you're taking too much of it, we certainly know it can cause kidney injury. I don't think the disease process that they're talking about specifically for ibuprofen has ever really been validated or actually studied. I would say certainly stick probably with Tylenol if you can, but if in between some of those Tylenol doses you need 1 or 2 doses of ibuprofen, it's probably not going to be detrimental. So that's kind of the best answer we have right now for that, ibuprofen versus Tylenol or another fever reducer.
So much still unknown, it sounds like, Doctor.
Yeah.
And some other reported symptoms have started to come out. New York's largest health provider reported 10% of patients there had gastrointestinal issues. We've heard that from some local folks, too. Other patients have reported loss of smell and taste. What's going on here? Are these symptoms we should all be looking for?
Absolutely. You know, the gastrointestinal or the GI symptoms, those are pretty well documented, even from the studies from China, anywhere from 3% in one study to up to 30% in another study. So that's pretty well documented. And really, the main reason for that is the receptors that the virus latches onto in our body are present in the lungs, in the heart, but also in the GI system. So it's not unreasonable that you do have these symptoms. That's a very well-described symptom for this infection. The other symptoms, the anosmia, the loss of smell, the loss of taste, we know that this occurs in other respiratory viral illnesses or other viral illnesses, so it's not surprising that it may occur in this as well. I don't think it's specific for coronavirus, but we have had other reports and other studies, and it's been a well-known thing that these types of symptoms can occur with these types of infections.
Dr. Hawkinson, a lot of people are able to go outside just briefly with the weather getting a little bit nicer with that stay-at-home order in place. When they go outside, when they take those walks, still really important to stay 6 feet away from people if you encounter them on a walking path, right?
Absolutely. You know, it's good to get outside. That helps with health. That helps with immunity. But certainly continue the physical distancing or the social distancing. Try to maintain that 6 feet if you can.
All right, that's Dr. Hawkinson.
Thank you so much.
Absolutely, Jay. Thank you for joining us live this morning.